Congenital heart disease is an abnormality of the cardiovascular system that you're born with. You get it for a number of different reasons, but most of the time it's a combination of genes and environment. In Alberta, approximately 1 out of 100 babies is born with some form of congenital cardiac defect. People, if they are properly diagnosed, followed, and treated, can do extremely well.
My name is Jacky. I was born with a ventricular septal defect along with a stenosis of the pulmonary valve. So really, in a sense, I had a hole in the septum of the heart, and the right side of the heart wasn't working at all, so they had to get it all working together. My plumbing was all screwed up, so they had to change that, and then I had a narrowing of the pulmonary valve, which was replaced with a porcine valve back in 2000.
My name is Janet Hales. I was born in Edmonton, although I consider myself born and raised Calgarian. When I was a kid, I don't think doctors really knew the issue that I was experiencing. I've been diagnosed with congenitally corrected transformation of the great arteries, which means my arteries are switched around. I think I first knew there was something wrong as an adult was when I was involved in a physical fitness program and my heart rate wasn't normal. So I had some tests done at the time, but there was no immediate cause for any concern. A few years later, unfortunately, I found myself at the Foothills Medical Center being diagnosed with a stroke. But when I was discharged, I was introduced to the Congenital Heart Program at the Peter Lougheed Center.
The transition program is designed to provide seamless care as the individuals leave the children's hospital and come to the adult world.
Hello, I'm Chris Strickman and I'm 19 years old. I always want to get in broadcasting because I want to be behind the scene for the Flames game. My heart is on the other side of me. For the last 18 years, I was at the Alberta Children's Hospital. The staff were like family, but I'm looking forward to getting to know everyone at the Peter Lougheed Center.
You can imagine that people get lost as they transition from the pediatric hospital to the adult hospital.
My transition from the children to adult care was actually interesting. Growing up as a congenital heart patient, there wasn't really a transition program, and so I wasn't ever part of a changeover in the system.
The components that are critical to the functioning of the program are a database that allows us to track patients and their conditions appropriately. We rely heavily on nurse clinicians to do teaching and follow-up with our patients. Our social worker is integral to the program in that she helps guide individuals through transition and helps them with job counseling, counseling that helps deal with a number of the social issues that they may encounter. We also provide training for individuals in the field of adult congenital heart disease. And we contribute importantly to a number of research protocols, both at a national and an international level. Our biggest job, though, is to prepare the patients to become their own advocates.
They've given me the strength and the understanding to know how to cope day in and day out. The other thing they did was they gave me the reassurance that I can live a normal life. I can do what I want to do. And I can't tell you how grateful I am for that.
My daily rituals is usually I get a checkup, an ECG, they take my blood pressure. I do have a pacemaker, so they check that every 6 months. Everything is checked up very regularly.
We're really proud of the work that our adult congenital heart disease physicians have undertaken. We really want for them to be as successful as they can, and really that will only occur with the support of the community.
I think it's imperative that the community donate to this program because it is one of the areas in medicine where we really can make a huge difference. Prior to 1950, 90% of individuals born with complex congenital heart disease died before adulthood. Now, more than 95% survive into adulthood and go on to live very meaningful, productive lives.